Good morning, everybody. Today we are here with Commissioner Janez LENARČiČ, who is in charge of crisis management. The Commissioner will make a short statement, following which we will entertain a few questions. Commissioner, please.
Good morning. In these challenging times, when the whole world is struggling with the novel coronavirus, I am particularly pleased that today I can announce a team of European doctors and nurses from Romania and another one from Norway to be deployed to Italy. We all know for some time that Italy has been struck by this virus particularly hard. We also remember that initially there was an inadequate response to the Italian request for assistance from other EU member states. But things have changed now, and the reality is that Italy is not alone. The reality is that Europe stands in solidarity with Italy. So through the European Union Civil Protection Mechanism, today these two medical teams are being dispatched to Bergamo and to Milano, two cities that have been hard hit by the outbreak. They are going there to help their Italian colleagues in their bitter fight against this outbreak. Next to this, I would also like to mention that Austria has offered over 3,000 liters of disinfectant to Italy, also via our civil protection mechanism. Our European Emergency Response Coordination Center has coordinated and co-financed this European assistance. It is working 24 hours, 7 days a week with all member states to make sure that help is channeled to where there is most needs. Allow me to recall that ever since the virus has arrived to Europe, the Commission's #1 priority has always been to save as many lives as possible. Obviously, this would not be possible without the dedicated medical staff who represent the true symbol of European solidarity. Therefore, I would like to thank today to Romania, to Norway, and to Austria for coming to Italy's support in a time that is so difficult for everyone, for the entire continent and the world. This is European Union solidarity in action. At the same time, I'm also pleased that Italy has activated the European Union's Copernicus satellite system to help them map health facilities as well as public spaces so as to get clear understanding of activities, including activities in public spaces during the coronavirus emergency. Last but not least, yesterday, Italy also received a delivery of personal protective equipment, which was donated by China to the European Union. Several EU member states have also sent protective equipment bilaterally to Italy, equipment such as masks, overalls, and ventilators on their own. Some others have been taking Italian patients for treatment in their hospitals in their countries. Meanwhile, the number of cases in Spain has surpassed those in Italy. We are conscious of that, and we are working on that too. There will soon be a delivery of personal protective equipment through the Union Civil Protection Mechanism, equipment that is being donated by Taiwan. We are, in this respect, in touch with the Spanish authorities. All in all, I'm glad that things are improving. I'm glad that assistance is coming. And I'm particularly pleased that it has now become clear, apparently, that only together and by pooling our resources, we can overcome this unprecedented challenge. Thank you.
Thank you very much, Commissioner. We have also received a few questions from journalists. We have tried to pick those that give a good indication of the general interest that exists in this topic. The first question will come from Martina Stevis-Gridner from the New York Times. Can we have an update on the European Union's stockpiling of protective personal equipment? When will it be available and how will it be distributed to member states?
We are working intensively on setting up the European Union capacity of medical equipment, the so-called RescEU. We have already signed the first contract. The first EU member state to host this European capacity is going to be Romania. The contracts have been signed. The first batch of equipment, ventilators, has been ordered, and it is now up to the supplier to deliver it. I would not want to speculate how much time the supplier will need to do that, but we are expecting it soon. We are also in touch with some other member states who have shown preparedness, readiness to procure and host the medical equipment for the RescEU, European Reserve, and we are advancing with some of them as fast as we can.
Thank you, Commissioner. The second question will come from Rosa Jimenez from the Spanish news agency EFE. I would like to know if you foresee a date for the arrival in Spain of the medical equipment to be acquired by public procurement. Do you know if the orders have already been placed and the contracts signed? Do you think the Commission should have more competences in crisis management in the future and not only a role of coordinator?
As you know, the Commission has launched 4 joint procurement procedures, and some of them are nearing completion. It will now be up to the member states who participated in this joint procurement to place the orders with the suppliers that were selected, and thereafter for the suppliers to deliver the ordered goods. Again, it depends both on member states and the suppliers to do this fast, and it depends on them how fast they will do it and how many days it will take for the first medical equipment to go to member states, including to Spain. As for the competencies, it is clear that health measures, that civil protection, border management, things like that, these are competencies of member states, and the European Union, European Commission, plays supportive and coordinating role. So we try to do our best, but we should not lose sight of the fact that these are the competencies of member states. We try to have them act in a coordinated and aligned manner. We are doing our best. As for this to be changed, you know that this would involve treaty changes, and this is a long and not an easy process. So we have to do with what we've got, and we're trying to do that to our best ability.
Thank you. And the last question will come from Michael Peel from the Financial Times. There have been reports from EU countries, including Germany and France, of cargoes of medical equipment being seized and diverted to the US. Has the Commission investigated this problem? And if so, what is its understanding of what is happening here? In particular, is this simply a case of US customers outbidding European customers? Or do the Commission and Member States believe US authorities are directly or indirectly causing these cargoes to be diverted?
We are aware of such reports. We do not have investigative powers so that we would investigate this kind of reports. But we are especially aware of one fact. There is a global scramble for personal protective equipment, for other types of medical equipment, because there is a challenge for everyone involved. This virus has spread faster and further than anyone expected. This has resulted in a shortage of supply and a dramatical increase in demand. And when you have that, it's difficult to arrange that an orderly procurement, and especially it's not easy to arrange that the medical equipment goes to those who need it most. The fact is also that there are very many out there who need it very badly, and the number may even increase. That's why the Commission is trying to mitigate the impact of this kind of situation when you have such severe imbalance between the demand and supply. That's why the Commission has conducted intensive efforts to stimulate European production of medical equipment, to increase the supply of this equipment. It has launched 4 joint procurement procedures. It is planning further joint procurement procedures because that also helps to pull all those who need this equipment together and conduct a joint procurement process. And finally, the Commission also decided to set up European capacity once it became clear that there is a general pan-European problem in the supply of medical equipment. This became clear at the end of February, early March, when there was a lack of response to Italian request. As you know, the situation has improved since, but the Commission immediately started to work on creating such European capacity. For that, we needed to expand our legal basis. For that, we needed agreement by member states. We got that in mid-March, and on March 19, we had all things in place for creation of such capacity. We are now working on that, and we are advancing. We already have, as I said, signed the first contracts, and we expect the delivery of the first items in the coming days.
Thank you very much. With that, our press event has come to an end. Thank you, Commissioner, for coming down and briefing us on the latest, and thank you for all the viewers for being with us. Have a great afternoon.
Thank you.